So throughout your pregnancy, you're going to have quite a few visits. The first visit you'll probably come to us at the hospital will be around 12 weeks of pregnancy. That is a really long visit. It's usually an hour and a half, and we do a very good assessment of yourself, your physical and your mental well-being, and obviously of the baby as well. At this stage of the pregnancy, you won't really be able to feel the baby because it will still be below the pelvis.
If you've been feeling unwell with nausea, vomiting, that should be starting to subside, but for some women that does continue on for a number of weeks. Most women will be feeling better at that stage.
At the 20-week visit, you'll come back to us at the hospital, and at that stage you will have had your ultrasound. So we will go thoroughly through the results of that. In that ultrasound, we'll be looking at the baby because it will be fully developed by that stage. We're checking that it has all appropriate limbs, organs, and we're also looking for the site of the placenta, and hopefully it will be at the top of the uterus.
You will definitely be feeling pregnant. The uterus is basically at the belly button, so you definitely start to have a little tummy, and most women would be feeling baby's movement by that stage.
At that visit as well, we'll well and truly be able to listen to the baby's heart rate. So that might have been one of the first times that you have heard your little son or daughter. And we'll be checking your blood pressure as well and seeing if there's any complications that have arisen so far.
Once you're over 20 weeks, you can call Delivery Suite with any issues or concerns. We would also talk to you about antenatal classes and breastfeeding classes and encourage you to book them in.
At the 30-week visit, you come back to us again and your pregnancy is well and truly advanced by this stage. The uterus has grown enormously. By 30 weeks, it's well and truly coming up past the umbilical button. You'll be feeling your baby. The baby will still be swimming in quite a large swimming pool because there's a lot of amniotic fluid there, so you'll feel lots and lots of movements. Your breasts have been developing. Some of you will actually be able to see some colostrum, the very first milk, but please don't worry if we don't see it because it's not everybody that does.
So at 30 weeks, some things you might be experiencing might be fatigue. So your baby is doing a lot of growing and putting on a lot of weight at that time of the pregnancy. So it is important that you eat a really healthy, balanced diet, high in iron, and getting a lot of rest.
We'll begin to talk to you about some complications that might arise, particularly in the summer months. You might start getting some swollen hands and feet in the next few weeks. We'll also check the baby's movements and listen to the baby's heart rate.
And we would also do a palpation to check the position that the baby's in at that visit. We would measure your abdomen to make sure that baby's growing adequately. We'd do a blood pressure, and we'd also review the blood tests that the GP has ordered.
At that, we also talk about what to bring into the hospital. Not that we particularly want you to pack your bag at that early stage, but we like you to begin to think about it.
Also recommended that it's particularly if it's your first baby to attend the breastfeeding talk so you can learn the basics of breastfeeding because it is a learnt skill, and it's important that you try and learn the basics.
At 40 weeks, gosh, you're probably thinking my pregnancy should be over, but believe it or not, it's only 5% of babies born on the due date. So don't worry, you'll probably go a little bit over, particularly with it being your first baby. And at that stage, we begin to talk to you about what is likely to happen in the next week to 10 days, because you probably will go into labour.
So your baby should be moving every couple of hours during the day, and babies will normally have quite a vigorous period of movement in the evening when you get home and you're quiet.
We really encourage you to get to know your own baby, and please don't compare with your friends, and please don't start using apps because there are ones which encourage you to monitor baby's movements, but we prefer you not to use them.
If you are worried about, you need to call Delivery Suite.
So we like to talk to you about what the difference between your Braxton Hicks contractions are and your true labour contractions.
Braxton Hicks are actually contractions, but they're generally not painful. A true contraction is a bit like a cramp. So quite often women will describe it as a period type pain. That's what we call pre-labour, when the contractions are regular and strong. If you are uncertain, always call the midwife.
Some women, before they go into labour, the waters actually break. And what to do is put a pad on and also just tell us, the midwife will probably ask you what the colour of the fluids are. It's important to know what it is. It should be a sort of straw colour or almost clear water. If you notice any green tinge or any bleeding, then please give us a call straight away because we're concerned about that.
Around about this time, it would be good to have a chat with close family members or friends about how they can support you. It is a difficult time in the first 3 months. Your baby will be feeding 6 to 12, maybe plus feeds a day. So have everything prepared and washed, but try not to do too much. Just rest and look after yourself.
When you actually come into the hospital when you are in labour, the midwife will do an assessment of yourself. She'll find out what is happening. Are you having contractions? Have your waters broken? She'll have a feel of the baby. She'll listen to the baby's heartbeat. And she'll ask you about your expectations of labour. We might do a vaginal examination to see how far dilated the cervix is, just so we've got a guide as to where we are in the labour process. And then once the midwife has done an initial assessment, she'll probably go away for a half an hour or so, but she'll come back at least every half an hour to check on the baby. And if you're worried at any time, please ring the call bell and just get the midwife to come back in.
You're definitely in good hands at the hospital. At the Royal Women's, we deliver 4,500 babies a year. So if you're at home worrying about something, there is not a silly question. So just please call the midwife.